and the live stream will start any moment. Okay, well, hello, everyone. Welcome to Sci2022. I am Liv Vega, and I'm joined here by my colleague, Melinda Mochizuki, and we're part of the events staff and team here to help make sure that you have a wonderful virtual experience. There are breakout rooms that will be open through all the events, so there will be a help desk. So if you need any support there, please feel free to auto-select there or let us know in the chat if you would like to go there. And we also have created a safe space. So the help desk is room number 1 and the safe space is room number 2. So if you need a moment to step away from the conference, but still stay engaged and plugged in, please feel free to go there at any time. For this session, you are muted and you are not showing videos. So we hope that you are able to focus on our wonderful opening keynote presentation. There will be a Q&A towards the end of this session, and you'll be able to ask questions to our speaker in the chat. So with that, I turn it over to CSA Director, Jennifer Shirk.
Liv, thanks so much. And everyone, welcome to Sci2022, our now annual event. And we're really pleased that so many people are joining us for such a rich program. I'll be saying more about this in a moment, as will others on the planning team. But I did want to let you know that in an effort to make everything easy to access this year, we are operating on a single Zoom line. We'll be using breakout rooms for many of the sessions. And as Liv mentioned, you can move yourself among them at will, and we'll work on getting you fluent with that. Because we're using the event in this way, we are sticking with a very strict time schedule. So please be aware that things start and stop at the times indicated. And we're glad to have you joining us throughout on the schedule as posted. I do want to mention that there are so many people who are making this event possible, including our sponsors and our volunteers as well. And before I say more about that, I did want to just mention that we are all here to connect, that the C in C Science this year means many things to many people. And we will be talking about that over these next 4 days. I do want to mention that at the heart of this event is a C that means connected. We are here around shared commitments to work that happens through science and monitoring beyond the bounds of scientific institutions. And we're here because we have common concerns about how to do that well. So take advantage this week to the opportunity to connect with each other, to share your ideas, to build out our opportunities to listen and to learn from each other, and our community of resources that we are for each other as we move forward in doing this work. And that community is true at the level of this conference as well. This conference would not be possible without many people, including the volunteers named here, as well as our staff and CSA's board. And we'll be making ourselves available to you and commenting and engaging throughout this event, both here and on CSA Connect. But right now, I want to introduce you to Rihanna Putnam, who is our community engagement specialist and program manager, as well as Julianne Chavez, who is our newest team member and who is here to support programs throughout. Rihanna, over to you.
Thank you, Jennifer, and thank you everyone for joining us today. It's been so great to get to know some of you and your work early as we've been seeing your posters come in. If you haven't had a chance yet to check into the event space on CSA Connect to look at the wonderful posters that are there, please do so. If you have any issues accessing them, feel free to reach out to the events at email, and Julianne or I or one of our other planning team members will get back with you. We also have an amazing set of action-oriented sessions planned for each day, and those have all been coordinated by our volunteers, mostly from our working groups. We have 7 great working groups that you can access through CSA Connect to learn more about them. In addition to the things that you can find on CSA Connect as part of our virtual event, there are also regional events happening across the country, and we are excited to have them and really are thankful to the regional hosts who have brought this event and this keynote to their communities. So thanks to everybody who's streaming in today. And I also really would love to thank Alison and Abigail, who are the co-chairs of our program, for all that they did to help bring this event to us and shape it into what it is today. I hope everybody gets as much out of it as we have been planning it. With that, I will turn it over to Alison Cawood to introduce, or wait, excuse me, sorry, Abigail Hils, who is our other program co-chair, was unable to join us today, but she has prepared a land acknowledgement that we're going to share via video. So if you stay tuned, we're going to play that.
Hello all. Good morning, good afternoon, and good evening. I hope you all are well. Thank you for being here at the Sci2022 conference. I am one of the conference co-chairs. What I'm very thankful is that I've been given the opportunity to acknowledge and to honor my cousins and whose lands we reside upon. Oki, Senatapi, Anukse Sikoi, Nisokoa, Abigail Hils Yongyats. My English name is Abigail Hils. I am a mix of Mitsitapi, Ganawagan, and white. Where I currently reside is Washington, D.C. D.C. sits on the ancestral lands of the Anacostians, as well as the neighboring Piscataway and Pamunkey peoples. D.C. and surrounding regions reside on lands ceded in the 1666 treaty between Lord Baltimore and tribal leadership, establishing a reservation known as Piscataway Manor. It shares borders with Maryland and Virginia states and connects with lands along the Anacostia and Potomac River systems and current national parks, which are where the Piscataway, Pamunkey, Nantigo, Mattaponi, Chickahominy, Monacan, and Powhatan cultures thrived. I acknowledge all First Nations, Métis, Inuit, status and non-status across Turtle Island as the keepers of these lands. All non-Indigenous are treaty partners with the government signing on your behalf. Land acknowledgements are critical for creating a safer space for Indigenous, as well as honoring the hosts as guests and honoring your role as a treaty partner. My humblest apologies to the Blackfoot elders and language keepers as I try to learn proper pronunciation. Any mistakes or misinterpretations are on me. Also, please know that I do not speak on behalf of all Indigenous peoples, but I want to share what I know as I walk down my red road. If you have any questions or comments, please find me in the virtual space. But also, I want to give you a moment to recognize which lands you sit upon. Please visit native-land.ca to figure out which tribes actually reside in your space. And this can be your start to your journey to unpackaging which lands and which treaties were broken for all of you to recognize that we all need to grow and be better together. And with that, I want to say thank you, and I hope the conference goes amazingly.
I think I am not sharing the correct screen here. Is that the case? At this point, I want to, I know Abigail, if she were here, would be introducing Alison Cawood at this point. And Alison has been our committed conference program chair for several years now. And we are grateful to her for her programmatic vision and her collaboration with Abigail and others, as Alison has led us through challenging times for connecting over 2 years now of virtual conferencing. And together with the team that she has convened, she has helped keep at the heart of this program the spirit of why we conference, rather than recreating something we might do together just in a virtual environment. So we are grateful to Alison. I am introducing her here to say a few words, and Alison will then introduce our keynote speaker. Alison.
Thank you, Jennifer, and thank all of you for being here today. We are really excited to share the C-Science 2022 conference with you, and we hope you get as much out of it as we kind of envisioned when we were all putting that together. Just a couple of things before I introduce our speaker. When you registered for the event, one of the things that you clicked on was a code of conduct. I will put that in the chat really quickly. That is kind of the formal pieces for how you could be removed for the conference, and the kind of more structured version of what is expected of anyone who takes part in this. But there's also a set of community guidelines. These were started last year by our equity group, and they really talk more about how we want to treat each other and be treated in this space, and what we can and should expect of each other in this space. So these were community commented. I think the equity group put it together, and then there was plenty of time for community comment. Those were put back out for community comment before we started this year. And we would appreciate and invite you to add any thoughts and comments to that as we go during this conference, and continue to have this be a living document and something that we can share within this community as we work to treat each other in the ways that are the most productive and lead to the best outcomes for everyone who is participating here, and make this a space that we all want to be in and be part of. So now it is my pleasure to introduce our keynote speaker, Dr. Mónica Ramírez-Andreotta. Dr. Ramírez-Andreotta is an assistant professor of soil, water, and environmental sciences at the University of Arizona. She has she does really interdisciplinary work that she's going to talk to you about during her talk, but her background is all really interdisciplinary as well. She has undergraduate degrees in ecology and evolution, as well as in studio art from the University of Arizona. She has a master's degree in public administration, and then from Columbia University, and then she came back to the University of Arizona to do her PhD in soil, water, and environmental sciences. Her work really focuses on the interactions between plants, soil, water, and people, and community and environmental health. And she runs 2 really fantastic community science efforts, Garden Roots and Project Harvest, that you can go learn more about, where she is doing not only some really fantastic work related to soil science, but also engaging people in that in ways that are meaningful and provide input that is necessary for communities to be healthy. She's done a lot of publishing, not only in science, but she's also has a new article out about the community science work that she's done and how her group approaches that. And she's also an early career, she's won a AAAS Public Engagement in Science Award, which is a really high honor for early career researchers who are doing work that engages with people, as well as doing really strong science. So I'm gonna stop rambling now. I'm really excited to hear Monica's talk and to learn from what she has to say today. So Monica, thank you so much for being with us.
All right, thank you all so very much. It's a true honor to be here, and yeah, just super excited for this conference and to get us started. So let us start sharing my screen. And all right. Thank you all for your introduction. And again, it's a true honor to be of service and to be presenting here to all of you today. So to begin, we did a land acknowledgement. I want to do a land acknowledgement for Arizona. So Arizona is home to 22 federally recognized tribes, with Tucson being home to the Tono O'odham and the Yaqui. Also a shout out that the University of Arizona is a Hispanic serving institution in the state of Arizona. To begin, thank you all for your efforts, all the community researchers and scientists that I've engaged and had the honor of working alongside over the years, and special shout out to the Citizen Science Organization and the great team of individuals who have organized this conference. I'd like to start off just talking a little bit about myself. So I was born and raised in Tucson, Arizona, which is home, as I stated, to the Tono O'odham and the Yaqui. And my community, or Tucson, Arizona, lies within 100 kilometers of the US-Mexico borderline, a symbolic boundary reminding us of the 1983 La Paz Agreement to protect, conserve, and improve the environment of the border region. I'm second generation Mexican-American, or Chicana. I went to the oldest high school in Arizona, and I am dedicated to environmental protection. And I've been working with urban and rural environmental justice communities since 2006. I am the daughter of an engineer who spent time as a miner in building public health infrastructures in the US-Mexico border region, with a grandfather who refused to speak English as a form of political protest. Bearing witness to the social environmental degradation completely changed the way I saw and experienced health. Health no longer became synonymous with biomedical services. It was about the interconnectedness among social and ecosystem services and human health and well-being. Within these experiences, I also witnessed a tremendous amount of resiliency. Now I am an environmental health scientist, inspired by the possibility that through partnerships with environmental justice communities, I may be able to leverage my position to elicit structural change. I serve as a cultural knowledge broker in participatory research, build trust across cultures, translate data into forms that are adaptable and useful for community members, as well as other stakeholders, to shift the balance of power. And so this is my Nana or my grandmother in the upper right corner. Here you see the map of the 100 kilometers into the United States and to Mexico, designating the border region. And just a shout out to my family and parents. As already stated to you, I'm a transdisciplinary environmental health researcher, truly trying to pull disciplines together to address challenges of the life world. You can see here environmental science, public health. I have an art degree, as well as did a postdoc with a sociologist. So I run a laboratory and have an amazing set of students that I work with and colleagues, and we are striving for environmental health and climate justice for all. We live in a time, right, where pollution is now the leading global cause of premature death and disease. So you can see here on this infographic, and if you'd like more details, you can see the citation below. But 9 million premature deaths, 16% of all global deaths. So exposure to contaminated air, water, and soil kill more people than a high sodium diet, obesity, alcohol, road accidents, or child malnutrition, child and maternal malnutrition. They're also responsible for 3 times as many deaths as AIDS, tuberculosis, and malaria combined, and for nearly 15 times as many deaths as war and all forms of violence. If we take this a little closer to, well, within the United States, you can see here's a map of all federally designated cleanup sites within the United States. 1 in 4 Americans live within 3 miles of a hazardous waste site, meaning that your zip code can be more important than your genetic code, which is also known as social determinants of health. So we know that we're living in a time where we see environmental racism and we're striving for justice. When working towards justice, there's fundamental and critical challenges. To name a few, we are challenged by the limits of epidemiology and public health, technical elitism, and where you can have a expert, quote unquote, overriding the voices of the communities in which are experiencing the challenges. We also know that conventional methods have failed. Conventional health intervention and health promotion strategies have largely failed to mitigate the sources of environmental health risk for these environmental justice communities. And the reason why they're failing is because the strategies are addressing health at the individual level, rather than the interacting social, cultural, and political context in which these health disparities manifest. So we strive for environmental justice because we know if we achieve this, we would reduce environmental health disparities. These disparities are differences in health outcomes, and they're unnecessary, avoidable, and unfair and unjust. This is the motivation of the lab. This is the motivation of myself. So we strive for structural change. We want to see change at the meso and macro level. We want to change things related to environmental policy and regulation, and to address what perpetuates injustices. So one thing that we're all here and all familiar with is participatory research methods. Here is a, not an exhaustive list, but 16 different terms that have been proposed in the literature by scholars and practitioners. One of the exciting things to recognize with this list is that people from across different disciplines are coming to the same conclusion. Those who are experiencing the challenge are closer to the solution. We should be building in participatory research methods into our efforts. And so let's continue to care for our communities and realize that we're all in this together. And regardless of the term we want to use, we recognize that participatory research does lead us closer and can increase our chances of achieving justice. As you see here with the title today, we have See Science. Just want to acknowledge this terminology and recognize that these efforts are transforming investigations, changing the way that science is being generated, who's generating the science, the types of tools that we're using to understand our environment and other processes. But it's also changing the way we talk about and report back data. But to be transformative, this process needs to begin with listening and humility, which leads to partnership building. So it's critical to acknowledge that when you go into these spaces, that you check yourself at the door, that you listen, and you operate with cultural humility. So for today, we talk about how we should be leveraging and can leverage our positions of power through collaborations in ways that work upstream to structurally address the systems that perpetuate the injustice. And for today, I'll be using the examples from the lab, Project Harvest, and Garden Roots. So here are a generic set of steps, community participation in the scientific research process in the most generic form here, looking at steps 1 through 10. And I'll be going through each of these steps and talking about how we've worked alongside communities. So to begin with, let's imagine you live near resource extraction. These are a set of images coming from the state of Arizona. You can see here, these are mine tailing piles. This is a Morenci mine. We also have the smelting and all of this to support metal extraction. This is one of the last smelters. And so when we think about partnership building and defining questions, community members who live in these spaces are coming up with very good questions. Are my soils safe? Is ingestion of soil and plants grown locally contributing to arsenic and heavy metal exposures? Is my air safe to breathe? Are there pollutants in harvested rainwater? And their concerns are legitimate, right? If we look at the number of toxic release inventory sites within the state of Arizona, when I took this screenshot, there was 264 toxic release inventory facilities in the state of Arizona. And the larger the circle, the larger the waste footprint. Where you saw those larger purple circles are these communities, or some of these communities. You can see I've been working in Tucson, Southern Metropolitan Tucson area in partnership with the Sonoran Environmental Research Institute since 2006. Dewey Humboldt, a community that's sandwiched between mine tailing waste and a former smelter. Globe Miami, which is near active and legacy mining activity. Hayden Winkleman, which has a smelter and is periodically active. And Superior, which is has does not currently have any active mining, but there is a large proposed mine within the vicinity. If we move along to thinking about gathering information and resources, developing explanations to support the defining of the questions and partnerships, I'm going to show some quotes from participants. You can see right below the mine was our school, Washington. That was when the smelter didn't have any controls. There'd be sulfur smoke coming out of the top of the stack. When it rained, you'd get acid rain. We'd be choking because the fumes were so bad, but it was just part of life. We lived there and accepted it. This is the area they're speaking about. Here's a parent living in another space talking about having 2 epileptic children. Epilepsy is very common around here. So is kidney disease and lupus. I would contribute this to contaminants in the mine. So in these different spaces, when you start this partnership building and you start listening, you're defining these questions, you're working together to further define the efforts, but also to continue to build the trust. And so this ability to build a partnership and engagement can take many forms. In this community, you can see that this is where a superintendent was very much had an interest and concern about environmental quality, but also wanted to be sure that whatever we did also built the capacity of the students. So they very much wanted to support informal science learning activities for the school and students. And so this is where partnerships were led and continue on with informal science activities. This is an example where there were 2 community champions that very much wanted to start and be part of Project Harvest, but they were like, Mónica, you're gonna have to get a blessing from the mine and talk to the mine before you start working here. This was the first time in my experience where I actually had to do what they call the quote unquote dog and pony show to industry to operate within a community space. This is where I gave a presentation. The community champions were there to witness the presentation and witness the reaction of the mining company. The mine said, okay, this seems like a great project, continued on to do the work. And the majority of the engagement and trainings for the community were held in this Bullion, which is now a cultural museum and plaza. However, has a history of being the segregated school up until 1952 for Mexican-American children. So me going in there as a Mexican scientist, but also bringing students into these spaces required that historical context and analysis and understanding to not only operate, but to also understand the community's history and to teach new students in the space. Here's a community where it started with a coalition leader, Roy C. Chavez, who just to take a moment of silence and shout out to, who passed away recently. Roy taught me what it was like to work in these mining communities and the different types of contested spaces that I might be engaging and operating within. But they welcomed me into this space, and you can see here, this is the mural in their town hall where the human body is actually turned into a drill, demonstrating the high level of mining impact into this culture and space. This is another example showing working with local community health workers or promotoras. This is again in partnership with the Sonoran Environmental Research Institute, where we trained about 20 promotoras on climate change adaptation and resiliency efforts, how to build passive and active rainwater harvesting systems. Also had the promotoras work in the lab and learn how to process soil samples. And this is my mom who was in the training, which is quite special. When you take on this type of effort and you engage and build these relationships, you will come up and you'll engage individuals that are coming from a variety of intersectionalities. Here we see that within Project Harvest specifically, over 50% of the participants were from limited income households, people of color, did not have a college degree. About 47% were from rural communities, and about 25% spoke Spanish as their dominant language. And so one of the things that we wanted to understand is that how did we get this level of participation? And so you can see the citation below, but we analyzed what was the motivation of these non-traditional participants. And we see here that non-traditional is defined below the table, that non-traditional participants are more likely to be motivated by an existing relationship with individuals or an organization, or when the activity is addressing a perceived risk. So and the design strategy for this is to build upon existing personal and organizational relationships. I identify and have participant liaisons like promotoras that share key traits and identities with participants, and clearly connect the research to identified community issues. We also see here that non-traditional participants are less likely to be motivated by learning for the sake of learning or by contributing to science. So do not assume that participant motivation to contribute to scientific research or increase personal knowledge will be the way into increase and to engage. What we've shown here is it's based on existing relationships and clearly connecting the research to identified community issues and research questions. If we look at how participants were supported, we can see here that they're more likely to be supported by personal interactions than written materials, meaning that the participant liaisons or the community health workers or promotores were key to this effort. Building opportunities for ongoing relationship building is necessary. Open communication between all participants and staff and participants with each other is critical. And then also doing data sharing via social events to support peer-to-peer data interpretation with staff support. And I'll be talking a lot about data sharing at the end of this talk. Barriers that we observed was that non-traditional participants are less likely to have the reliable computer or internet access. So this is where you design alternative participation or alternative ways to participate to digital tools, and you provide access to necessary technologies and personal user support. Another thing is that lack of time was frequently reported, and this is where we built in a level of flexibility and had a tiered participation structure where participants could decide to do a do-it-yourself, do-it-together methodology, or they could do a traditional laboratory method. If we move along to data collection and collecting samples, we can see that across projects, community members, based on their needs and research question, have collected irrigation water, drinking water, food from their gardens, food from their grocery stores. They've collected soils from play areas. They've collected soils from where they're growing foods. They've collected soils from areas where they want to set up a play area for the future. And we've also done dust analyses as well, collecting by a ghost wipe sample and an inverted disc, as well as foliar dust. What I want to highlight here is that community members are trained on how to collect samples, but then when they get to their home or their garden or community space, they do what they think is best. They collect the sample from the area that's of concern to them. They collect the foods that they're consuming that are culturally relevant, and they collect at times that are meaningful to them as well. Here are just some beautiful pictures of some of the samples we received in the laboratory. Here are soils from across the state of Arizona and different foods that have been submitted over the years. Analyzing samples and data is a little bit different. You can see here that for the project harvest, the do-it-yourself methodology or do it together was where participants had the kit at home, they would run the experiment, and then they'd report the data back to us when they were ready. This is interesting going back to participant barriers and motivation. We noticed that with this activity, you do it at home again, you report it back to us. We had an online interface set up where they could be reporting data back. However, we were getting very low numbers of data sets back, or data findings from community members across the state back. This was of concern. We started talking to promotoras, started talking to participants, and they're like, me da flojera, no quiero, they were basically like, I don't want to go online. I'm doing the experiment, I'm writing it down, but I don't feel like going and using the online interface. A promotora is like, can't we just make a paper copy for them to fill out and submit? I was like, yes, we can. And then boom, we had like 4 times more results coming in just by having a paper copy. But this is a time where community members are doing the experiment on their own, the time that makes sense to them, and sending the data into us. When we think about the interpretation of this, again, I'm an environmental health scientist doing exposure science work. And so we're trying to essentially get the best data into this generic calculation of the milligrams of a contaminant someone might be exposed to per kilogram of their body weight per day. And to do this, you have these conversations and you talk about like, how long are you in the garden? How much are you eating from your garden, and doing dietary assessments. This allows you to do a more site-specific analysis and truly answer the question about exposure in their spaces. What's important to recognize is exposure pathways are different by metal. So in this work, you can see this is just from one community where the dominant exposure to arsenic is from water and food. For cadmium, primarily coming from the plants that they're growing and food sources. And for lead, we see this distributed a little bit more evenly, but however, plants and soil are the dominant contributors. In addition to this, the plants themselves have different uptake patterns by contaminant and plant type. So this is critical to acknowledge based on consumption patterns, dietary patterns, and cultural relevancy. Moving on to the last section about well, it's the last section of this, but the interpreting data, disseminating that data, and discussing the results and asking new questions. So data sharing and data report back is a very, very critical component of the work. And so components of data sharing to and with participants should include a description, an analysis and form of comparison, and recommendation. So you do this work together, you co-generate the project, you co-create the data set, and so now you actually work together to identify the best ways to share the data with the participants and the rest of the community. And something we've seen across the board of these projects is that you want to have description, analysis, and recommendations. If we look at to inform this data sharing process specific to Project Harvest, we had formative evaluation. So working with promotoras, internal and external advisory board members and participants, a subset of participants, before we even did a broad data sharing to ensure that the visualizations we were preparing would be of use and be able to translate into action. We also used a mixed methods approach to data sharing and learning research to understand what people were doing once they had their data set and were part of this project and effort. This is just a shout out to a handful, right, of visualizations that we should be thinking about. This is, again, just something that's very dear and near to me of just thinking about how to communicate the results. And once you have these different ways, you should be thinking about this level of engagement. And this form of engagement can take many different forms and be tailored to the communities in which you're engaging. Going back into, this is specific contents of a results packet provided to participants in Garden Roots. So you have a project overview, you provide important terms, you have the data divided out into sections, you have comparison values or existing standards that the participant and families can use to interpret their data set. You provide additional information, references, and then again, always providing prevention and intervention steps. Something that we started in Project Harvest was this consenting to receive individual household results. So we know that for human research, you do an institutional review board application. For the University of Arizona, the environmental monitoring data is separate. So the IRB did not want, they're like, we don't need to, read or hear anything about the environmental monitoring. However, right, a report came out about or a paper came out about the legal implications of report back and household exposure studies. This is where I said, I'm just going to make a consent form about receiving the individual data set. So you could decide that you wanted to be part of the, you're part of the project, you want your data, you want to have your individual data to compare to others, or you could say, I do not want individual data. I just want to see all the data in the project. And so we wanted to make sure that people knew that if they received their individualized data, that there could be chemicals that we were monitoring that could create legal duty to notify potential buyers and renters, as well as visitors who would have a particularly high risk of exposure. At the beginning of Project Harvest, about 20% of the participants said they did not want to receive their individual data. But after we did a first year data sharing, they changed their mind and said, I really want to see my data based on how what they witnessed others experiencing with having their site-specific information. So these are just a series of throwbacks, reflecting on that I've been doing this work for about a little over 10 years. But in one community, right, this was a Superfund site. You had federal and state oversight and regulation. So it was very important to unveil the risk assessment and exposure assessment processes so that they were understanding how these cleanup values were coming about, but also to answer the community members' question about how much they could eat from their garden based on a specific target cancer risk. And so in this case, looking at arsenic exposure. Looking back at how to communicate some data to parents, again, dividing out the percent contribution from the different environmental media within their child's environment. And now we have reading the graph here for Garden Roots is just having, of course, standards advisories or guidelines that participants can compare their values to. And for Project Harvest, we had this visualization, which went through about at least 10 to 15 different versions. So they would compare their rainwater sample to the field blank they collected. They're then able to compare it to everyone else in the study, as well as different standards and reference values that were available. Within Project Harvest, I was very much interested to learn and to see how people, if there was a different recall and reaction to receiving their data through an art experience or just the booklet. And so this is where I had a Master's of Fine Arts student, Dorsey Kaufman, who developed Ripple Effect, which is this essentially converting the data point into a sound wave. So you have a speaker with a tray of water on top. And then, so the more the vibration, the higher the concentration. And then if that light went off, that means that it exceeded a standard. So we're very interested in learning and seeing how people were responding to their data sharing, their data based on data sharing type. And all of this, you present strategies and solutions to reduce exposures so that right when they have their data set, a participant and family member are able to take necessary actions to reduce their exposure if necessary. So now we move into the whole section of like, what can I or we do, right? And so one of the things is you can think about individual choices. Here's some examples presented here. You can make these choices about washing your homegrown vegetables. You can modify your own behaviors and change your individual action. This is where if we use the environmental health literacy framework, you would imagine that these would fall within scientific and environmental literacy and numeracy. And so we did see, right, participants using their data sets to inform decision-making. But here's a quote from a participant. Being able to participate in something that's at my home and I can see what happens there, and they get these types of laboratory results that show exactly what's going on is really valuable. And that if I had any perceptions that's different than what this booklet is, I have to reconsider and say, these are the facts. So this is important that, right, you can imagine that all of us have our own mental map. And so this is where the data set might have either complemented or challenged their mental map, and they were changing their understanding based on their data set. Unfortunately, due to the pandemic, we had to, because of the high level of interaction in Project Harvest, we had to cancel the two last sampling events for the project, first and last monsoons. One of the things we decided to do was, though, is just to ask survey questions to see how participants were doing, to see if they were more reliant on their gardens and harvested rainwater during the pandemic. But a promotora was like thinking, you know what we should ask, right? Because again, all of this is co-generated. You have the promotora as community health workers, part of these decision-making processes. They were like, you wonder, because the participants have received their data sharing and their data visualizations and booklet at the end of every year throughout this project. I'm wondering, you know, they're like, I'm wondering if they're able to better understand pandemic data now that they've been part of Project Harvest and have been receiving these visualizations. And I was like, that's a great idea. Why don't we incorporate that into the survey? So we asked that question, and sure enough, over 60% of participants agreed or strongly agreed that due to their participation in Project Harvest, they were better able to interpret the pandemic data. If we move into, continue to move out, but look at what we can do and move into the middle concentric circle, we see action and self-efficacy. One of the things we saw was that at the beginning of the project and then 1 year in, that participants started with high self-efficacy, right? The sense of control and confidence in learning and doing science. Started out high, and they maintained that they reported high levels of self-efficacy 1 year in. We did not see an association between self-efficacy, race, income, or education level. So simply put, all those socioeconomic factors affect countless other life outcomes. They do not predict the success of a community scientist. When we look at data interpretation and action, we see that across the board, participants are interpreting their data and taking action. This is a Sainsky diagram where you can look at the results comparison. So what were they comparing the results to? What was their form of interpretation? And then what was their intent to take action? So here you can see that you can follow one stream to see what that participant decided to do and how they came about that reasoning. But the other thing is to look at how their reasoning and decision-making might have varied by report back style. But in the most simplest words, right, we can see here that action was taken and that action was evidence-based and supported by their data set. Participants either stopped using the rain, continued to use it in their garden or stopped using it. One of the things we saw that since one of the standards we provided was a poultry and livestock standard, we saw that participants would stop giving that water source to their animals. Moving on to continuing on with this, what can we do, but looking now at collective action. So this is a little bit more challenging. We can all imagine what type of collection action we might be taking. If we look at community engagement and social engagement, we can think about structural change. And so this is where I'm going to highlight some what Combi et al. Calls the little P, the little policy examples that have come up throughout Garden Roots. So one is that the Garden Roots in one community revealed that the public water utility was serving water that exceeded the drinking water standard for arsenic. This is where participants, families had their data set. They presented that data set to the state, shared it with other community members to put additional pressure on the state to go and test this water source. I was also providing the data set and talking to state and federal agencies. State Department went out, tested this water supply, and yes, in fact, it was exceeding the drinking water standard for arsenic, and that water utility was fined and issued a notice of violation. If we look at another community, this is looking at this timeline. So going back to what I was talking about in the beginning of looking at the social, cultural, and political contexts that create the injustices, this is where you can see that 1875 is where you had mining begin in this area. And so Garden Roots was brought in. We were asked to help out and address some community concerns around 2018. And so we're continuing to work in this space, reported all the data back in 2020, hosted 4 different meetings, attended coalition meetings, but through this ongoing engagement and not being bound by a grant or just starting a partnership and maintaining that partnership, we have new efforts in the area. We're consolidating and merging all the Garden Roots data with soil studies conducted in the area since 2002, and we're generating visualizations to inform new families moving into this area. We also, using this model, assess whether dust passively collected on plant leaves can serve as a low-cost air monitor and indicator of metalloid-laden aerosols. This is where we have community members and coalition leaders as a co-author, but also we can see that this is being recognized nationally as being one of the National Institute of Environmental Health Sciences 2021 papers of the year. In addition, in collaboration with the Arizona Department of Health Services, Pinal County Public Health, the National Institute of Environmental Health Sciences, and the University of Arizona, we're hosting a soil shop for the Superior Arizona community. So that this is a community service where participants can bring a soil sample and have it tested for arsenic and lead. If we continue on with structural change in the little P, I want to highlight efforts in the Hayden-Winkleman area, where this is where community members sent, or you have a community champion where they're like sending them a bunch of different pictures of the mine tailing waste moving off site. That champion sending it to me. I consolidated all these images into a report essentially quickly to then distribute to almost 28 different local, state, and federal agencies that are all working at this site. And so since 2016, I've been leading multi-organizational calls for this alternative Superfund sites to ensure that all of us working in this space are working together, being transparent, and aligning our communications for the benefit of the community. And so now at our last multi-org call, we had the EPA compliance officer on the call saying, I need all these pictures. I need to know how many times community members are reporting to the state that there's, in this case, that the industry is not following the consent decree in this space. Here's an example with the rainwater. So this is work being done in our lab, and just shout out to Kunal Palawat, who's a PhD candidate in my lab, where we saw that a worker strike in the Hayden-Winkleman area impacted the arsenic and lead concentrations in harvested rainwater. So this is where you see the social act, right, of going on strike due to working conditions. And we could see that this was, we observed a decrease in the average winter arsenic concentrations and a decreased range of lead concentrations in rooftop harvested rainwater. So this is where the community members' social action right, to striving for justice is actually reducing, right, the concentration of arsenic and lead in rainwater. Another shout out, looking at the Our Soils team being led by Dr. Abby Kinchi, and we see we have just different activities that we've been doing over the years. This is, again, I'm all on this like structural change, like what can we do now that we do this type of community science and participatory work. Here is a bilingual comic book that was prepared. As a team, we submitted a public comment regarding the EPA draft lead strategy. And we also, have produced a manuscript confronting legacy lead in soils in the United States and community engaged researchers doing undone science. So just a big shout out to the Our Soils or Nuestros Suelos team. Also a big shout out to those who are talking about the conundrum of rebranding. Here you see the inclusive, diverse, equitable, accessible, large scale participatory science working group. On the organizing committee, along with Karen Cooper, Chris Hahn, and Valerie Johnson, but a true honor to be engaging everyone in this effort to strive for what you see here of inclusive, diverse, equitable, accessible, and large scale. So stay tuned for products coming out of our efforts. Woo! All right, I'm gonna end with, with this a quick overview of participatory research for environmental justice, a critical interpretive synthesis. This paper, first author Leona Davis, where we asked the question, what are study design elements that prompt structural change to benefit environmental justice communities? I'm highlighting here, right, Environmental Health Perspectives Editor's Choice Collection 2021. So this is showing like 2 papers using participatory, like about participatory research, about justice work, about transforming the way that science is done to achieve justice, being nationally recognized. So you are in the right space at the right time and should be continue this work to strive for structural change. So after reviewing, right, there's 500 papers, we narrow it down to around 200, and we identify around 26 that have identified and achieved structural change. And what we see is the design elements that are prompting structural change to benefit communities. Research questions informed by local knowledge. So 100% of the studies that describe structural change outcomes started with local knowledge informing the research question. We also saw that there was a moderate correlation observed between structural outcomes and project partnerships lasting more than 4 years. This is where you are going to be challenged by your grant cycle. But when you start working in these spaces, you don't stop, right? This is a commitment and a friendship, and you're just expanding your family. Another thing what was critical is you have community directorship and you have former participant structures built into your program design. You also open the policy window and start engaging decision makers from the very beginning. So you're starting to set policy related goals and engaging decision makers in the beginning and the inception of your work and throughout. I highlighted all of the types of data communication and translation and report back for Garden Roots and Project Harvest. We know that these efforts are important to prompt structural change. So in the efforts, we saw that not only were projects collecting data from more than one source, they were also collecting quantitative and qualitative data. And 50% of them engaged in data translation for decision makers. Participatory research values the multiple knowledges, including indigenous and non-Western forms of knowledge, which can be absent from modern decision-making spaces. So we know that when we're doing sea science and doing participatory research efforts, that we can package and make sure that this information is translated for different stakeholders and serves as a boundary object so that it is powerful and useful for all in different spaces. We also know that of the 19 studies that successfully achieved a policy win, those policy-related activities and goals were included in project planning. So I'm just really honing in on this because this is where we state and based, Cambi et al. Also talks about is you strive for these little P's, these little policy changes at the local or regional level to then build up over time versus going for, to build up over time. I'll leave it at that. You could read this paper if you want more information about that. Just a general critique of participation as benefit, which can be used and stated. So we know that there's a whole variety of research that supports the benefit to participants in participatory research for environmental health, right? So we've seen citing increases in understanding of environmental health risk, increases of self-efficacy to address them. However, we know that the benefits of understanding or self-efficacy will not outweigh that community member's limited time and energy to invest, nor will it provide a clear path to action. And so this is for the recommendations for the future is you leverage your power and privilege, you set structural change as a goal at the inception of your project, and you consider positionality. When we talk about structural change as a goal, what does that mean? It means that you're evaluating the root causes of identified health, in this case, environmental health risks. You're identifying the root causes and analyzing the power and policy structures surrounding the cause of that risk or that disparity that you're trying to address. You're identifying feasible structural change goals, and you are evaluating your efforts. So you're doing formative, process, and summative evaluation throughout this work to ensure that your efforts are benefiting the communities in which you're serving. And lastly, we talk about consider positionality. I started this talk out with a positionality statement. I am a cultural knowledge broker. I have an understanding of both the community experience and the science, and this enhances the rigor and relevance of the work I do. Woo! I was like so nervous, but so excited to do this talk today. But massive shout out to all the promotoras, community partners, researchers, students, and undergraduate and graduate level. These are community members and participants and, scientists and students at the University of Arizona. Thank you all to the researchers and students in my laboratory. And thank you all for listening today.
Thank you so much, Monica. That was fantastic. So first up, I wanted to say thank you for everybody watching, both here with us in Zoom, those who have joined through the YouTube live stream, and then we have the regional groups all around the country some of whom have watched this live and some of whom are going to watch the recording of this and have discussions. So welcome to all of you. Thank you for being here. I hope you got a lot out of the presentation. I wanted to start with a question, if that's okay? And then for those of you who are here in the Zoom room, if you want to start putting your questions in as well, we have a few minutes to ask some of those. So thank you so much, Monica. So one of the questions I had, and this is kind of thinking about with the Sea Science Conference and how we're framing this and looking at regional groups and things. Can you talk a little bit about how some of the work that you did is like, are there pieces of that are specific to the community that you are in or that would need to be different somewhere else? And are there pieces that you feel like are kind of universal that would translate across, kind of disciplines and communities?
Yeah, can you start out in the beginning again? Sorry, the beginning part of that question. I apologize.
Yeah, no worries. So like thinking about the work that you did and you really situated it in this kind of specific place and community. Are there like elements of the work that you do and the kind of analysis that you have done about these community-driven projects that you find that really applies either really specifically and has to kind of be rethought for every kind of new community and new situation? And are there things that apply, are there things that apply broadly, I guess, like kind of what is that balance, if that makes sense?
Yeah, I mean, the things that apply broadly are, and this is something right coming out of community-based participatory research. I mean, and, like thinking about like pedagogy of the oppressed and things of this nature is that you have to, you acknowledge that those closest to these challenges are closest to the solutions, and you really need to check yourself at the door and and operate with a level of reflexivity and openness and listen. So that's like the first big thing is like just listening and being humble and I mean, this is going to sound silly, but I feel like I have to say it sometimes to people is like, you can learn something here, right? You don't, and so that is something universal. The other big thing is patience. That they'll again, I really want to go and like really highlight community-based participatory research, because your ideas that you're creating, you want to make sure that things are co-designed, that there's that it's equitable, and that you are making sure that the work you do translates into action. And so I think that that's something that, no matter what, those are elements that you're going to apply across the board. The big thing is that, when the questions that people, the different questions that people come up with and how you come together to answer that can take different forms. But if you're operating with these kind of basic cultural humility, listening, and openness, that you'll get a lot more done.
Awesome. Thank you.